Assalamu alaikum wa rahmatullahi wa barakatuh. Very good evening. This is Health Matters. I'm Khawa Solomon. Shukran so much for joining us. And please do stay with us right up until 9:30, inshallah, as we handle TB patients and COVID-19. In the light of this infectious disease, fastly spreading infectious disease that we have facing our country at the moment. And as I've read some stats, we're on about 4 deaths, over 1,300 infected individuals. I think it's 4 or 5, yes, 5 deaths in South Africa that has been confirmed. And please do update yourself if that is important to you. But other than that, enjoy the information that we will be giving you with regards to TB patients and COVID-19. In studio, I have with me Dr. Shaida Umar from the IMA. Shukran so much, as well as the head of, or at least she carries the cap for TB Foundation, and we're so happy to have her expertise with us. But online via Skype, we will be linking up with Professor Nazir Ismail, head of the TB Center at the National Infectious Disease, National Institute for Communicable Disease, NICD, that's been in the news and in the light very much so. So just, coincidentally, it is also, and something that we focused on, and I was planning up until a month ago, was a TB Awareness Day, which was on the 24th of March. We did, unfortunately, have to cancel many events around that, but just looking at some of the information on the World Wide Web, the WHO still had their webinar with various doctors around the world discussing TB and COVID-19. But Dr. Shaida Umar, please give us an introduction to the show, inshallah.
Assalamu alaikum wa rahmatullahi wa barakatuh. Shukran dalilan. I think we need to look at the Quran once again, the safety precautions from the Quran and the Sunnah. And I think what we need to understand is that the Quran speaks clearly on hygiene. Islam has a unique way of dealing with the outbreak of diseases in 2 stages, that is before and after the outbreak of the disease. One of the objectives of the Sharia is the preservation of the soul, and everyone must take necessary measures to protect themselves against any harm. The next thing is to looking at purification. And we're talking now about sanitizing of hands, but in the Quran it makes emphasis on the purification of cleanliness, hygiene, the ablution, the wudu that we find ourselves involved in engaging 5 times a day. And I think that is something that we need to be very aware of. Islam also urges Muslims to observe the characteristics of fitra and the 5 practices of circumcision, plucking out hair, cleaning all the private parts of the body. And these rituals reveal that they play a great role in protecting the body from diseases. Then we look at lawful food and drink, and then also moderation and protection of food and drink. And Islam urges Muslims to consume foods, lawful foods, in moderation. And I think these are things that we need to be aware of, the mindful interaction, where Islam has put rules and regulations on interactions with the opposite gender. And if we look at after the outbreak of the disease, when a Muslim is afflicted with a certain disease, he has to look at it as a test from Allah the Almighty. Prophet Muhammad sallallahu alaihi wasallam said, "How wonderful is the case of a believer. There is good for him in everything," and this applies not only to a believer, but it applies to all people, the universe, the whole of humanity. And I think just also understanding that seek medication. Islam orders Muslims to seek medication. As COVID-19 says, please seek immediate attention for testing and for self-isolation.
Absolutely. And so our religion, alhamdulillah, guides us on absolutely everything, even in this circumstance. Jazakallah to Dr. Shaida Umar for her professional opinion on that. We now cross over to Professor Nazir Ismail. He is head of the Tuberculosis Center for NICD. Now, Prof, knowing that 1/3 of the world is infected with tuberculosis, what do we now need to know about the novel coronavirus?
I think the 2 issues around TB and coronavirus, the COVID-19 as most people refer to it, is that both diseases are respiratory infections transmitted through the air and contribute significantly to both morbidity, which is really disease, and wellness. and secondly, related to mortality and death. So I think one important thing to appreciate is TB is leading cause of death. As we face the COVID pandemic currently, it does put a lot of people's lives at risk, and together could be a fatal combination as such. Between these two diseases, COVID-19 and TB, COVID is fairly new. It's a novel virus that our immune systems haven't been exposed to before. In contrast, tuberculosis has been around for thousands of years. I mean, they found TB DNA in the mummies in Egypt, almost dating back to the time of Musa alayhi salam. So both diseases play a significant role in terms of human health. And I think as we move forward, both conditions are critically important to effectively deal with.
So, Professor, looking at the number with regards to TB, I've just doing some research and looking back and forth at the stats, because that's what it seems like everybody's been focusing on: how many deaths, how many infected. Is TB the number one leading infectious disease killer in the world?
Yes, I mean, unfortunately, that's the reality for a disease that's been around for so long, and for which we actually do have treatment that can cure the disease. Globally, there's estimated about 10 million people that are affected by TB disease. So I noticed you mentioned that 1/3 of the global population is infected. Most people might live with an infection. Your immune system contains it, and therefore people may recover and live healthy lives. Those that succumb to the disease are what we refer to as TB disease, where they display symptoms of cough, fever, loss of weight, etc. And among the 10 million estimated globally by WHO, 1.5 million die of the disease every year. So it's a significant killer globally. And among all infectious diseases, put HIV, malaria, etc., TB remains the leading cause of death globally.
What do we need to know with regards to TB? Because TB sounds pretty similar to COVID-19 when it comes to the symptoms, also prevention, and possibly looking at the way forward when you talk about those most at risk.
Yes, so the symptoms are very similar, at least at the basic level, which both diseases have a cough. Often TB has a productive cough, whereas COVID will often present with a dry cough, typical of viral respiratory infections. The second thing is a fever, which really is a marker of an infection usually. The other symptom that's fairly similar is tiredness, weakness, malaise, but that's a very generic symptom. So those three are fairly common. Where it starts differentiating is with upper tract infections particularly. You often find people sore throats, runny noses, etc., typical of your common colds, and the novel coronavirus can present in that kind of a way. Whereas TB is a bit different. It's more chronic disease where patients progressively worsen over time, have a cough that's running for weeks, and then end up showing classical signs of loss of weight and drenching night sweats. And those two are fairly characteristic at the later stages of the disease. But at earlier stages, they might just have a cough and fever that doesn't seem to go away. And you're right, they do overlap. And I think what we need to appreciate is that, especially in South Africa, we have the highest incidence of TB globally. And people that do display symptoms of cough and fever, even if they're COVID negative with appropriate risk factors, need to be investigated for TB. There's a lot of undiagnosed TB. So that's primarily on the symptom side. But as I mentioned earlier, the prevention side is also similar. Both are respiratory infections transmitted through the air. And therefore, there isn't sort of your classical risk factor for disease. If you look at HIV, there's certain risk factors that put you at risk for in getting that infection. Whereas with respiratory infections, influenza included, TB and the COVID-19, it's really around the people that you are with and exposed to. So the classical approaches is really around social distancing, self-isolation, etc. So if you have a respiratory infection, to prevent it from infecting others, it's about the space and the air that you share, as they put it. So those are the key commonalities between the two. Obviously, COVID is a new disease, and we really don't have any treatment available or preventative therapy. So the isolation and avoiding sick people becomes extremely important. For TB, it's fairly similar, but because we have preventative therapy and other measures, we do institute those appropriately. The last thing, maybe just to highlight, is that in terms of the prevention strategies for these infectious diseases, I think there's a big topic around masks. Everyone's running around wearing masks. So I'm quite happy that people are wearing masks, but it's actually probably quite beneficial for protecting yourself against TB currently than COVID, because we have a lot of TB in South Africa. Just to give you an indication, on an average day in South Africa, we have about 600 to 800 new TB patients with TB disease. So I mean, that's an astronomical figure just in South Africa alone. So your risk of getting TB is fairly high. The one important thing to appreciate, and just I think might be useful to highlight, is that you get different types of masks. But I think we can deal with the mask topic a bit later on, but just to appreciate that both are spread through the air, but there are some nuances between how they transmit as such.
Okay, shukran so much, Professor Nazir. Quickly, on your side, Dr. Shaida, looking at what we've presented now with regards to TB, and when I say the first leading killer, it's the #1 leading infectious disease killer in the world, and we're not talking about COVID-19. It's actually TB.
So if we look at TB, I think as Professor Nazir highlighted, that it's been there's been trials and tests conducted, so there is prevention and there is treatment available. Whereas COVID-19 being a novel disease, it's something that has just sprung upon the world, the global pandemic that has suddenly bombarded the world and has, as a result, created this alarm, because there is no cure at the moment, there is no treatment. And I think that is the difference between the two, where people continue to live with TB, there's hope and there's opportunities for therapeutic remediation, whereas COVID-19, we don't know. People are working on it.
Yes.
So the alarm pandemic responses are normal in this abnormal setting.
Definitely, and looking at the fast rate it's been spreading is another alarming case. So we talk more on TB, the #1 infectious disease killer in the world, tuberculosis, more just after this. We do interact with you as well. Assalamu alaikum and welcome back. A very good evening. This is Health Matters, and the topic, as we will be doing for the next couple of weeks within this 21-day lockdown. What are we on, day 4 or 5? Dr. Umar, I can't keep track anymore. We have to literally keep our calendar. Day 5. Day 5 of 27-day lockdown here in South Africa. How are you coping? How are you dealing with it? Please do tell us, interact with us during the show, after the show. We'd love how you are part of Health Matters. And we've got a quick surprise for you at the end of the show as well, how you can even get more involved in Health Matters. But welcome back, Auntie Shaida, Dr. Umar, and also we have Dr. Nazir, Professor Nazir Ismail from the NICD online via Skype. So just before the break, we spoke specifically on protection, and I was listening to, I think, the Health Minister with his press briefing, and somebody asked about masks, and what is we're saying, oh no, don't wear the mask, you wear the mask, you're going to get infected if you wear the mask. But what is ultimately the protection with regards to the mask?
It seems that every day it's evolving. The story evolves, and every day there's a different response. And I think for your PPE, your emergency protection, obviously the surgical masks, and the #9, there's a specific mask that would only be effective for those kind of professionals who come into contact with the coronavirus. But I know a lot of people are wearing masks and making masks from cloth, from all sorts of handkerchiefs, the bandanas. People are manufacturing them, using this as an opportunity to capitalize. Entrepreneurs budding up all the time. And I think what we've just heard this morning on the radio, they had different medical experts speaking to specific masks, where they said that the mask would only be after 15 minutes, it would lose its impact and protective measure. And somebody else said after 3 hours, so you would have to dispose of that and put on another mask.
Okay.
So there's different views and differing opinions, professional opinions on the use of the masks. However, I think just listening to the World Health Organization, where earlier this evening people spoke to the fact that it would protect people from bacteria, from other infections. I think what Professor Nazir alluded to as well. So in a home, in a family, if they wore these masks, it would be fine. I think we need to understand that, but we'll let Professor Nazir enlighten us more and share some more light on the challenges around the use of the masks. But it could only benefit people by wearing the masks because it's the droplets.
Yes.
And it's protecting oneself and protecting others.
Yeah. So Professor Nazir, let's look at the guidelines around using the mask, because they said, use it, don't use it. But when we are using it, what is important about using it to protect ourselves and others?
Okay, so I think there's two aspects to that. The first is the type of mask that's used. So you get one which is called the surgical mask. It's the most common one and usually the cheapest version. Yeah. And that is appropriate for droplet protection. And then you get what's called the N95. It's really a filtration capacity of 95% of particle matter. And that's really the most expensive version and really designed to provide airborne protection. So maybe it's worthwhile just stepping back a little bit to understand when we talk of droplet versus airborne. So COVID-19 is a droplet spread disease. So although I say it's shared air, but bear in mind that droplets are generally medium to large particles that are pulled down by gravity. So that's the rationale behind the 1 or 2 meter distance that people need to keep apart. Because it's really about the droplet that spreads through the air and finally will drop to the ground and become less of an issue. And therefore, a surgical mask sort of protects you from the large and medium droplets that may land on the mask on one hand. But really it's meant to, as the CDC and the WHO recommend, these surgical masks you see in front of you are really meant more for people with respiratory symptoms and to contain their droplets within, so it doesn't spread in the environment. And that's really the main value, not necessarily from protecting people. Protecting people really is aimed at social distancing. Coming to the N95 mask, which is a high filtration mask, that's really designed for what we call airborne diseases, and TB and chickenpox are your classical ones where we know they spread over large distances and survive in the air for a long period of time. And typically for TB, for example, you find these are very minute, what they call droplet nuclei, or essentially airborne particles that are less than 5 microns and can be inhaled through the nose and mouth and deep into the lungs and cause TB disease. So these N95 masks are really designed for complete seal around the nose and the mouth to make sure that no air particles can zip in through the sides, etc., and give you complete protection from inhalation. And these are really not the surgical masks, the N95s, one that you see in the picture, like the white one at the back. Those are really meant for healthcare workers that are exposed to people with TB and other high-risk respiratory infections. And the only time they're really of great importance when it comes to COVID-19 is where people the healthcare workers are generating aerosols, for example, suctioning, intubation of a very sick patient, etc. And that's where they're appropriate. The last thing just on masks as well, I think what's important to appreciate is that those masks get contaminated. And when you take that mask off, there's a risk that you could contaminate your hands while taking that mask off. So it's not just a straightforward process of just putting on and taking off a mask, but that mask is also a germ carrier, and therefore special precautions are required when you remove it, discard it safely, and then make sure that your hands are disinfected after use.
Professor Nazir, just one more question. The actual duration, or what is the maximum period that you would be allowed to wear that kind of mask?
The N95, you're referring to the high particulate filtration mask?
Yes.
So usually, I mean, the big challenge, I mean, it's not just the current COVID era, it's a very expensive mask, number one. There's often challenges with supplies historically and not just in the current COVID period. Ideally, these should be discarded after maximum a day's usage. It depends on the amount of usage. Obviously, if you're using it for an 8-hour shift, that would be fine, but there are fewer things to observe. So the one challenge with most masks, even the N95s, if you're using it for an 8-hour shift, your breath has water molecules that can moisten the inside of the N95 mask and reduce its efficiency. So more than a day would be problematic. But obviously, if you're using it on a rare occasion, for example, you only do a morning hour session, and for conservation purposes, as long as it's your own mask, you may, from a resourcing perspective, consider keeping it, but you'd need to put it in a special designated bag so you don't contaminate it and others recognize that it's only for your use and therefore do not get cross-infected as well.
And then one last question before we end with the mask story. All the masks that are being manufactured at home, you know, people are making all sorts of, with fabric and other cloths and materials, plastic, perspex. What is your take on that? I think just for the viewers to understand.
So I think we need to separate the general purpose population fear factor mask and health-related use of a mask. So I think the health-related surgical masks are designed for appropriate, like when they're doing a wound dressing, etc., so they don't contaminate the wounds. You know, those factors, the N95 for specific airborne precautions, and TB specifically in our environment as such. When we're coming to all these other, we've heard of handkerchiefs as well, right? I think there's a lot of fear factor around it. I think, those, as I mentioned, even any mask or even a handkerchief for that matter could get contaminated again. It's a false sense of security because you contaminate your hand with that. So I think we need to be very cautious about that concept. I do appreciate that obviously if a person has a respiratory infection, they live in an informal settlement, there isn't really any other means to limit that droplet spread in that environment. Then using a handkerchief, might be, that's the second best option, right? But obviously that kind of a situation, you'd want to make sure that that's disinfected with jik, etc., and really sterilized as best as possible. What's probably preferable is actually tissue paper. Simple tissue paper is far more effective because you can discard it as single use and really provides a better protection, in my opinion.
Shukran, Professor Nazir. Looking at the mask and the protections that we need to use, why is it that healthcare workers and TB patients are still dying when there are these sort of protections available, and unfortunately TB is killing them?
So I think what we don't appreciate of TB is its highly infectious nature. I think people have heard of this reproductive rate of COVID-19, a reproductive rate of around about 2, meaning that it had a doubling effect. When we look at TB, so the problem with TB is that you end up with infection and you end up with disease, and you end up with a R0 and you have an R effective. Your R0 really refers to your infectious risk, and TB ranges. It's not 2; it's 10 to 45 times, right? Your reproductive rate. So it's multiple fold higher than COVID is. However, the effective rate is about 2, which is similar to COVID, meaning from exposure to disease. So that's the first thing. I think we don't appreciate the scale at which it's infected the population. And you're right. About a quarter of the globe, which is about almost 2 billion people, are infected by TB. So this is no ordinary disease, and I think that's something we need to appreciate. In terms of the deaths related to that, and I think the biggest challenge we face with TB is often it's undetected for most of its period. So we're worried about the COVID asymptomatic period, but there's a lot of asymptomatic TB out there as well, or partially symptomatic TB. People don't think of it much. And that really leads to a lot of transmission events. that contribute to the disease and its reduction in the community. And then the second thing is because people often, there's a general perception that TB is a disease of HIV-infected individuals. If you have HIV, you have TB. I mean, if you just look at the stats for South Africa, when we have tons of HIV in our country, about just over half are HIV co-infected, meaning 40% of our TB cases are HIV negative. But if you look at the more recent work being done, it seems like we actually have a lot more HIV negative TB than HIV positive TB. And we're not thinking of it often enough. And there's probably a lot of people that die with TB too late or undiagnosed. And I think that appreciation of the symptoms and the need to seek out TB is something that's very important. And I think TB is really underappreciated as a infectious disease. And that's part of the problem. I mean, if you just look at the global reaction to COVID, right? And just by the fear factor of the number of people that could die. But if you look at TB, I've mentioned 1.5 million people annually die of TB. It was actually 1.5 million 2 years ago to 1.2 million, 1.2 million last year. So this is something that has not received the reaction that it deserves if we really want to reduce this leading infectious disease cause of death.
So we want to look at, when we come back after this short break, what is really happening with the TB patient when they contract COVID-19, and how you as a community, as an individual, a family member of those affected and infected with tuberculosis, what you can do about that as well. Please do stay tuned. More just after this.
I couldn't.
Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back, and please do stay with us as we wrap up in this segment and the next. Your questions on TB and COVID-19, please do WhatsApp us, and we have the specialist online via Skype, Professor Nizar Ismail, head of the Tuberculosis Center for the NICD, National Institute for Communicable Diseases. And they're in the public, they're in the news, they're everywhere. So if you don't know who the NICD is, gosh, you're definitely behind some rock, or you're self-isolating from social media as well, and from the news. In quarantine, in every aspect. So Dr. Shaida is also with me, and we want to touch on sort of the social aspects with regards to TB, and how we're talking about self-isolation, isolation in today's time with COVID-19 being around. But in fact, there is a real impact on TB patients when they are diagnosed. And today, if you are found running away and you COVID-19 positive, and you're not, you are infecting others, it's against the law. But that's exactly how TB patients feel.
So you're absolutely correct, Khawa. I think if we just look at historically, a patient with a diagnosis of tuberculosis, the immediate response, the social response, the public response is that of forced social isolation, where the person is, basically quarantined from society. There are certain medical situations where the person would have to be in isolation and has to stay in hospital. But we find that generally the response, because of the lack of knowledge and information, people are treated differently, and they treat it as if they have leprosy and they're going to contaminate the whole world around them. They're highly infectious, and people would refrain from any form of social contact with that individual. So they're really frowned upon and not received well by society in general. And I think, so that's one of the social challenges of TB, and I think that has been a long-standing thing where people are afraid to actually share their diagnosis.
Absolutely. So, Professor Nazir, if we could look at that aspect, how common is it for TB patients to become depressed with regards to being so isolated when they have been diagnosed, or whether they have to be hospitalized for long periods of time? I believe the treatment is something like 6 months, if not longer, 9 months, 2 years. Some of the articles I read of some patients that had lost their hearing because of some of the treatments, and then they've suffered from depression. So let's talk about, you know, and the 27 plus tablets that they might be able have to take every day, added to that maybe antidepressant as well. Talk to us about, you know, the effects of the social isolation and isolation itself when it comes to TB patients.
Yes, I think the psychosocial aspects of TB treatment, and as Dr. Umar has highlighted, the issue around stigma plays a big role in both the patient's well-being, but secondly, the patient's behavioral aspects around completion of treatment. But I think the first is around the stigma issue, and I think what people need to, I mean, obviously it's similar to COVID. I mean, you know, people are fearful. If you got COVID, you're going to run away from the person. The same fear factor drives it with TB is that they're afraid that they could be infected, etc. What's important to appreciate about TB is that there's effective treatment. And really, if you have a family member or a friend that has TB, the sooner they start treatment, the better it is for them and for you. The infectiousness drops by about like 90% in 48 days using appropriate effective treatment. So really it's a very potent thing to protect oneself. And really there's no need to have stigma for TB because it's a disease that has affected, I mean, all strata of society, rich, poor, etc. Amazingly enough, even late President Nelson Mandela had TB in his early life. And he survived, he's cured, and he produced, he really has been a stalwart of peace for the globe and never gave up on his TB treatments. I think that's the one aspect that needs to be appreciated. The issue of self-isolation and the psychosocial aspects of it, it is quite challenging. Luckily for drug-susceptible TB, although it's 6 months of therapy, that 6 months of therapy is really oral treatment and you can take it from home. So there's no hospitalization unless there's a medical indication, for example, a severe pneumonia with shortness of breath where they might need temporary hospital care. So there isn't really a need for them to necessarily be quarantined within a hospital. For drug-resistant TB, that was the case. A lot of it was related to hospital admissions, and it was mainly driven, as you say, by this whole bunch of tablets that people were given, and a lot of, 4 months, there was sort of injections given for treatment of drug-resistant TB. South Africa has become a world leader in changing that now. I mean, currently a therapy for drug-resistant TB in South Africa is reduced from around 24 months down to about 9 months with an all-oral regimen. And South Africa has sort of done the clinical trials and really made a huge difference. So a lot of our drug-resistant TB patients are no more managed in hospital. They managed and decentralized from their homes, and they have decentralized sites and points where they can collect their medication. So I think it's been a major revolution in how patients do get their treatment. The one challenge, I think, so the isolation aspects have become less of an issue because we have effective, appropriate treatment. Where it has been a very difficult, and I think that's where the coalescence of TB, poverty, alcohol and drugs really joins together. And this is where we see a lot of the psychosocial problems. You often have patients with TB who are addicted to alcohol or drugs, which really makes the adherence more challenging. And some of that hospitalization leads to more aggressive behavior. So there's a whole negative psyche that goes through that process. And I think the decentralization is aimed at dealing with part of that. But there is a lot of efforts required towards more behavioral aspects related to TB. Just the one other thing maybe worth also mentioning is that with TB, I think the one challenge we also face was related to adherence. So, you know, it's quite challenging to take medication for 6 months. Taking antibiotics for 5 days is often a challenge. And these medications are not necessarily all the side effects that people do experience. And, you know, the first few weeks are often challenging, and usually it'll improve over time. But I think what people need to appreciate is that although people might feel a lot better after a month or two, they need to complete their 6 months of therapy. And primarily the main reason for TB specifically is that last segment of treatment is sterilizing, meaning that it prevents relapses. And that's a psychosocial aspect as well, because they've gone through so much, they're tired of this medication, and that's counseling that is important for making sure that people adhere and complete their treatment for a successful cure.
Professor Nazir, a quick question. I think what you're highlighting is very critical to the well-being and success rate of the patient, that a multidisciplinary approach is the way to go, because awareness raising, conscientizing, the psychosocial support, so it's a more holistic and integrated approach to the treatment of the patient with TB.
Yes, exactly. I mean, like, you know, for HIV, we've been doing pre and post-test counseling for decades, and the terminology has changed recently. But the challenge is that with TB, I mean, it's still a sort of a treatment requiring 6 months of therapy, and really making sure that it's not just about the tablets they take, about the environment that they live in, their comorbid diseases. And often a lot of these patients come from poorer income in clusters as such. And therefore, that additional social structures that they need to support themselves are often underappreciated and underdealt with. There has been in the recent years a lot more emphasis on that, specifically the drug-resistant TB program and also drug susceptible. And I think as Muslims, we have a lot of staff that might have TB. And understanding the challenges that they face, their treatment, and also the food requirements. I mean, you need to take these tablets with food often. And if you don't have food, it's a problem. So I think we also as Muslims do have a responsibility to provide some social and psychosocial support for people that are really in distress.
Absolutely. So looking at those TB patients, when they do contract the virus, what does that mean for their TB? And, or at least they've gone through the regimen, they've gone to, the 6 months treatment or the 9 months treatment. Is there a possibility that the TB would reactivate?
Okay, so just one correction. I noticed you used the word virus, and so TB is a bacteria and COVID is a virus. And just to appreciate that bacteria can survive on their own. They have cellular structures that allow them to survive and function on their own. Viruses almost are required to hijack a cell to really be able to replicate. And that's actually the sort of the reason why we have treatment, a lot more antibiotics than we have antiviral agents, because often they really, your mechanics that you're targeting for treatment almost interfere with human cells as well. So that's why antivirals are more difficult. Coming specifically to your question around the relapse issues. So the key drug that we use to treat TB is called rifampicin. And its primary effect is what we call sterilization. And although we find like the one other drug, isoniazid, it's rapidly killing in terms of reducing the bacterial load in a person. But often TB is a very slow-growing organism that hides in subpopulations and pockets within the lung. And it's really the rifampicin drug that really penetrates and can disable those bugs to make sure that they don't reactivate. So reactivation is uncommon unless a person has not completed their treatment. And the reason for giving 6 months of treatment is really around preventing relapses. So you've heard I've said that the 24-month drug-resistant TB regimen has been dropped to 9 months, and that has been using other drugs that prevent relapses. They've tried it for drug-susceptible treatment, trying to go from a 6-month regimen down to a 4-month or 3-month, and that to date has failed in multiple clinical trials, really highlighting that the early work on rifampicin has proven that rifampicin is a potent sterilizing drug, and it really, the 6 months is key to preventing a reactivation or relapse of disease.
Sorry, Dr. Nazir, we have literally 30 seconds to wrap up. Any important information, contacts, or important information with regards to websites, literature that people can find, how they can educate themselves with regards to TB and COVID-19?
Okay, so I think with COVID, I think the NICD website's got tons of information. So www.nicd.ac.za. There's also information on tuberculosis on our website. There's an A to Z index, and you can click on that. The World Health Organization has brilliant documents out on TB, on COVID as well, and I recommend those are really two reputable sources of information on COVID and on TB. The CDC in the US also produces quite useful information. And those three would be my main primary sources that I'd recommend the public to access.
Shukran. Jazakallah so much to you, Professor Nazir Ismail. Jazakallah for your time. Unfortunately, our time has run up. Dr. Shaida, you've got 20 seconds quickly to wrap up.
So it's just get tested, get treated, and there is a beautiful and healthy life after TB.
Absolutely. It is preventable. There is treatment out there. Follow the regimen that is given to you when you have that 6 months, 9 months. Remember, it used to be 24 months. It is important that you take your medication to stay alive. Shukran so much for being part of this edition of Health Matters. As I said, a little bit of a secret we'll let out of the bag. Next week, we start Health Matters Extra. Stay tuned for that, and there'll be more information, so watch this space. Wassalamu alaikum and goodbye for now.